Good morning, everyone, and thank you for joining us today on this beautiful day that it looks like fall is coming way faster than anybody wants it to, but we will welcome it with open arms as long as there's no snow. So we have a really informative webinar today, and I want to not take a lot of time so we can get right to it, but just a couple housekeeping items before we get started. As always, today's session is being recorded and it's being live streamed on our Facebook. Microphones will be on mute for the duration of the webinar and will be unmuted if you use the hand raise function to ask a question. We will find you and unmute you, and you'll be able to ask your question. Today, you will only see the video for people that are talking or presenting with us today. We do have closed captioning available if you would like to avail yourself of the closed captioning. There's an arrow to the right of the closed captioning button and just click on show subtitles and you'll get the captions for today. As always, there's 3 ways to ask questions. If you have questions, we do prefer that you want to type. We prefer that you use the question and answer box or window. If there's just kind of chat, or if you have questions and you're not familiar with the question and answer window, you can feel free to use the chat box. And also, if you would like to ask a question aloud using the hand raise function, which in the list of attendees or participants, you will right click on your name and click hand raise, or you can also find it at the bottom of the meeting controls. You can click hand raise and someone will find you and recognize you. Today's topic is really talking about employment supports and accessing those employment supports in the community during the reopening from the pandemic. We today have Todd Culver with us from Encompass, Michigan, formerly Morrow, Sherry Johnson from Mid-Michigan Industries. We have Bob Stein from the Michigan Assisted Living Association, and Jennifer Boney from Progressive Lifestyles. And we are also joined by Bob Sheehan from the Community Mental Health Association of Michigan, and Chris Burgess from Health West in Muskegon. And each of the gentlemen that are joining us from the associations will be talking about the association's response to the reopening, and then the local provider will talk about their experience. And then we will be joined by Brenda Stoneburner from the Behavioral Health and Developmental Disabilities Administration at MDHHS to talk about the department's perspective on this issue. So without further ado, and the order that I just went in is the order that people will be talking. So without further ado, I give you Todd Culver.
Thank you, Tedra. Thanks to you and the DD Council for this opportunity, and thanks to everyone who's taken time out to join us this morning. I know that time is precious these days. My name is Todd Culver. I'm the CEO for Encompass, Michigan, and that's a statewide network of comprehensive human service providers working together to develop independence and achieve inclusive communities. And while the members of this association do offer a really comprehensive array of service options, employment is at the heart of the mission for the majority of our members. So I'd like to tell you a little bit about what the association has been working on since the onset of the pandemic relative to employment, beginning with where we were back in March, which seems like a long time ago now. But with the onset of the COVID-19 pandemic, the majority of our members suspended services within just a few days, particularly after emergency orders were put in place. And what that means is programming was largely closed, and employment opportunities, folks being served through those organizations were disconnected from their employment opportunities unless that job was regarded as part of an essential service. Since that time, our association has been working very hard to connect member organizations with the best information available, the highest level of connectivity, and reliable resources to help them to make good decisions as service providers and businesses on how to navigate these very challenging times. So what that has meant is we host webinars like this one. For over 20 weeks in a row, we did them every Friday morning. We've scaled that back a bit to do them every 2 weeks now. We developed within just a few days a page on the association's website, which is dedicated to COVID-19 with public health resources, information updates, the stream of executive orders that have come from the governor's office, which now number over 170, and done our best to help members synthesize and digest that information in a way that's relevant and useful. We've also segmented our website to contain sections that are specifically dedicated to resources on the process of reopening, which I'll talk more about in a moment. Tips for communicating and staying in contact with the people supported through those organizations, and also how to connect both persons served and staff with mental health supports during these very challenging and sometimes stressful times. We've issued information and action alerts regularly on federal and state legislation updates, new guidelines, or pandemic response resources. Took a moment to count them before we gathered this morning, and there have been over 80 since mid-March because there's a lot of information out there, as I'm sure you all know. We also try to connect our members through regional meetings like this one that have been transferred to a virtual platform. And with regard to beyond the information with advocacy, our focus has been on 3 areas: emergency funding, premium pay for the direct care workforce, and access to badly needed personal protective equipment. By emergency funding, I mean there are 3 primary sources of relief to help service providers and businesses sustain and continue during these during the emergency orders and especially during the stay-at-home orders, and even now that there are still many restrictions in place due to the pandemic. So those involve the Paycheck Protection Program, a requirement here in the state of Michigan for the public behavioral health system to implement what are called network adequacy plans that offer stability payments to organizations. And there are also some federal funds available through the CARES Act through a program called the Enhanced Provider Relief Fund. With premium pay, Encompass Michigan, along with MALA and the CMH Association of Michigan, have advocated for increased wages for folks who've been serving heroically on the front lines, providing direct care and supports. We've been successful in securing through the legislature and with the support of the Department of Health and Human Services a wage increase of $2 an hour, but that is temporary and time limited, so our advocacy will continue in that regard. And with regard to access to personal protective equipment, there was a desperate shortage, as many of us remember, with the sudden onset of the pandemic, and we worked very hard with the support of our members and other partners to get access to PPE to our members. When the stay-at-home order was lifted in June, our members engaged in the process of what was termed a soft reopening. There was a high priority to try to reconnect people supported through those organizations with their community and the supports that they were receiving, including employment and other vocational supports. What that means, a soft reopening, is there was a lot of time spent and a lot of effort put into implementing the new cleaning, health, safety, and sanitation protocols that are required to maintain a safe working environment, and also a great deal of training that needed to take place with both staff and persons served who were reconnecting with programming about new procedures that needed to be followed that are in conformance to the guidelines for keeping people safe and healthy when they're at work. Most of our member organizations began providing services after that soft reopening period had completed. Services such as skill building, community living supports, supported employment. But most members at this point are still reporting a progress towards capacity of a range of 15 to 50%. Some will report more, a few less, and I believe you'll be hearing from a provider who has encountered variations within that range as well this morning. But that's about where we are, and I say that to let folks know that as soon as it was permissible under the guidance from the state of Michigan, our members began working very hard to try to connect folks with service options that included skill building and employment. The providers in our network stand ready and willing to help people reconnect in those ways in a manner that's consistent with the highest level of assurances for the health and safety of all stakeholders involved. So that's a little bit about our journey as an association, and from a very high level, some of the things that we've been doing in response to the pandemic. At this point, I'll turn it back over to you, Tedra, if you'd like to open it up for any questions for me, or queue up Sherry to take the next segment.
Let's go right to Sherry, and then we'll take questions for you and Sherry both.
Great, thank you.
All right, thank you, Tedra. My name is Sherry Johnson. I am the CEO at Mid-Michigan Industries. We are based in Mount Pleasant, but we serve a 7-county region in central Michigan. We provide community living support services. We provide VR services to both youth and adults. We do skill building, CLS services, supported employment, just kind of a wide range of things. As Todd referenced, when everything kind of went into that shutdown mode, we provided very limited services, primarily the CLS services that were needed for individuals related to their health and safety. Community employment services for the people that we serve who were working in essential roles. We continued to provide those services and supports. And then we also did some virtual skill building during lockdown. In mid-June, we returned to face-to-face services in a very different appearing than what it was before the pandemic. Those services right now are all community-based. We're not providing any services in our building. People are coming directly from their residence to locations in the community. Most of those locations are outdoors in parks and public spaces. We have, when those services resumed, we tried to keep people together in the same groups to the greatest extent possible. So if they resided in a group home, they came as a group home to that location in the community to receive those services, and then they would go back. If they lived with an individual family or perhaps on their own, then we created groups and have maintained consistency of those groups so that people are exposed to people outside of their environment to the smallest extent possible. We did not resume our contracts with the public transit providers. Instead, we asked group homes or family members to transport those individuals in. In some cases, when we're providing transportation for mobile crews, for example, that transportation has been greatly reduced based on the ability to maintain social distance. So we were not able to provide all of that transportation safely, so we reached out to get help to make sure that that happened. We do require that individuals wear a mask if we are in an indoor setting or if we're not able to maintain social distancing. Our current status, our VR services are back at almost 100% capacity. And had continued throughout the pandemic. Our community employment services, although there are fewer jobs available right now because of downsizing that occurred during the pandemic. The work sites that are open and working, we're at 100% in those areas. In some of our service areas, our CLS services are back to 100%. In others, those are less, closer to 75%. The areas where we've seen the greatest reduction is in our skill building services. We have about half of the people who are participating in skill building services, but even those 50% of people are participating at about 50% of the amount of time that they were participating before. And our, what we call community connections, it's a group CLS service that we provide. We have about 25% of the people participating, and those folks are participating, again, at less capacity than they were previously. Some of the reasons that we hear for people not coming back, I think, is there's some understanding at some group homes that the executive orders of the governor prevent people from returning to work. And so that has not happened. In other cases, the person or perhaps their guardian just aren't ready for them to come out. They don't feel like it's safe. They want to keep them in a safe space. We serve a number of people who have an inability to wear a mask or to maintain social distance. And so they have not returned because they're not able to comply with those requirements. We have some folks who transportation is an issue for. We're trying to work around those situations as best we can. Some of the people that we serve are just not able to have their personal assistance needs met in a community setting. Being able to use a public restroom may not have the supports that they need to be able to meet those needs. And then other people are just not comfortable being in the community. You know, the weather, it's been a very hot summer. For some people, that's more of an individual reason for why they're not back in services. We, about a month ago, stopped saying, "Are you ready to come back?" and started asking instead, "What will it take for you to come back?" So that we can sort of do a deeper dive into what those individual needs are and see if there are ways that we can address and try and meet those individual needs. So that's kind of, at MMI, that's where we are at this point.
Thank you, Sherry. Thank you, Todd. Do we have any questions for Todd and Sherry about the community rehab or voc rehab response? Sherry, I think people would like to know from you how you got so many people to be able to come back. What was the secret?
Well, it may sound like we have a lot of people who are back. To us, it doesn't feel that way. We miss the people that we serve, and we know that there are still a lot of unmet needs. I think that for us, it has just been communication and a willingness to be flexible and to do what we can to meet people's needs. Safety is first and foremost. Choice is first and foremost. We don't want to push anybody into coming back into services, but if that's what they want and we're able to meet that need, we want to do that. So I would say that it's just been communicating and trying to educate people about what's available and what's okay, and being respectful of what their needs are.
We can have a couple of hand raised, Tedra.
Yes. Becky, you can go ahead and
Hi.
unmute yourself.
Yep, I just got it. Thanks. I was just wondering, Sherry, did you, what are your guys' program hours? Are you back running like a full day? Because we were looking at doing like a reduced work week.
We are running 5 days a week right now, and actually we sort of provide services across a wide range of times. One of the things that we did, and you heard me say early on that we are at about 50% participation, both the individuals and then the services that they receive. We know that lunch represents a risk. And so we're providing, where before people might come for a full day of services, we're providing a service in the morning And then those folks typically go home for the remainder of the day, both to receive assistance in the restroom if that's what they need, or to eat in a safer environment. And then we're also providing a service in the afternoon. And so but that is 5 days a week. When necessary, we're providing services in hours that are a little bit different. Typically, our day was kind of a 9 to 3 before. We do have some services that are taking place later into the late afternoon, early evening hours, again, based on what needs are.
Okay, I appreciate the input.
We do have one more question. We have one more hand raised. Chiseled.
Yeah, Chisholm.
Chisholm.
Hi,
Hi.
my name is Deborah Chisholm, and I was just wondering, you had stated that you had everybody going outdoors to the parks and public places. What will you do when the weather change? What places are you going to have your consumers go to then? I mean, what buildings, or what are you going to do? And especially with trying to keep the social distance.
That's a great question. So most of our group sizes are at 4. So we have, 4 persons served to 1 staff. So certainly as we feel the fall creeping into that chill first thing in the morning, we know that our time to be able to use the parks is pretty limited. Fortunately, when we started this in June, we had a very difficult time finding locations. There are more and more community spaces that are beginning to open up. So some of the service clubs may have a hall that we can use. A lot of churches have space that they're going to make available to us. We are even looking at the possibility of renting some apartments that we might be able to use for that activity. The apartment is our least preferred option, because we would prefer to be in a community space to the greatest extent possible, but at the same time, we need to be able to meet people's needs. We may allow some services in our building on a very limited basis if necessary. Again, it's not our preference. Our preference is to be in a community space to the greatest extent possible.
Deidre, we have one question in the Q&A. Are you ready for it?
Yes.
Mark McWilliams writes, Todd and Sherry, thank you for your presentations. Do you foresee any long-term changes in your organization's work coming out of the pandemic?
I'll go first, Todd. I think that, Mark, I think for our organization, our change is going to be more community-based services. That's something we've been working toward. A lot of the obstacles that we have continuously run up against, all of a sudden we're able to work around those obstacles. I think that we will probably never go back to looking the way that we looked before, but I think that we will still continue to meet people's needs. I think that will just be done in different ways. So for our organization, it's going to be a lot of change, a lot of flexibility, but I don't think that any of that is necessarily bad.
Yeah, and I can chime in as well very quickly. So we're not a direct service provider, we're an association, but I can tell you that our business model and the way that we support our members will change in that staff development and training was a big part of how we support members, and doing that in person and converting those existing programming to a virtual platform will continue into the foreseeable future. And I believe that folks will access professional development and training information virtually in the long term. And as that extends into our members, I think each will explore their options for supporting people virtually as well through various types of telehealth and remote and virtual service options, where it provides effective supports to the individual based on their choice.
Thank you, Todd. Tim from New Horizons says, we are getting similar responses as Sherry indicated, in that a number of residential settings, Sherry, this might be a question for you, but let's see. In that a number of residential settings, interpretation of the governor's mandate is persons served in residential settings can't return to the program. the mandate only restricts visitors. So we are working with our providers to clarify that and help persons served return to the program. Question, how to best address the residential settings we are communicating with them. Lastly, we do have virtual services available for those individuals that aren't comfortable returning. So how to best address the residential settings that are not letting people return. And that might be a great question to segue now to Bob Stein and Jennifer Boney, who are representing residential settings here today. So Tim from New Horizons, if you just stick with us for a little bit longer, I think your question will, the answer to your question will become clear. Mr. Stein, are you ready?
I am. Thank you, Tedra, and good morning to everyone. I appreciate the opportunity to participate on this webinar. I am Bob Stein, General Counsel for Michigan Assisted Living Association, and our nonprofit organization represents a broad range of community-based providers, many of whom provide residential services through the behavioral health system, both in licensed group homes and then also as providing staffing supports to individuals who live in self-directed living arrangements. And in terms of the pandemic and what we've done as an association, of course, although there were signals something was coming, I think it's fair to say that the entire behavioral health system was overwhelmed by the pandemic in February, and particularly in the beginning and middle of March. And it really has not ended in terms of the numerous challenges. I think from a residential provider perspective, certainly first and foremost, as for all of us, is protecting the health and safety of individuals with disabilities. And in licensed settings, of course, that is a 24-hour responsibility. And even in the non-licensed self-directed living arrangements, in many instances, that responsibility is for many hours per day, and even in some instances, 24 hours per day.
Can you move me to panelists?
The major challenges that the association has been working with its members on, certainly the staffing crisis, which we know was severe to start with before the pandemic, has dramatically worsened during the past few months. And one of the very first challenges that residential providers had was to be certain that they had sufficient staffing for each shift to properly protect and support individuals. As Todd alluded to, there are also, of course, throughout the whole system has been the issue of the shortage of personal protective equipment. And while the situation has improved, still a major challenge in the system, including for residential providers. Another issue has been sorting out all of the executive orders, the MDHHS guidance, MIOSHA requirements, county health department information, federal documents from CDC, simply the guidance in terms of what providers should be doing relating to protecting individuals with disabilities in residential settings. And much of the association's time has been committed to disseminating all of the information that's relevant for residential providers. We do have some members who provide vocational supports. The majority of our members are residential providers, and also fielding questions from members, both technical guidance, compliance questions, legal issues, and I think a fair amount of emotional support from the MALA staff, which primarily in terms of fielding questions from members has been Kathleen Murphy, who's also general counsel, Brenda Roberts, who's director of quality assurance and education, and myself. With regard to the executive orders and the question that Tim raised, and it is an excellent question, we have throughout the pandemic, clarified for association members that the executive orders related to visitor restrictions, which started with Executive Order 7, and now last week is Executive Order 174, those restrictions have not changed other than an emergency order that Director Gordon issued on June 30th, which provided some additional flexibility for family members to enter residential settings to assist with activities of daily living. But essentially, the visitor restrictions have been limited to visitors who are necessary for medical care, if individuals are on hospice care. Obviously, regulatory agencies have access to the settings. And then there's also language about individuals who have responsibilities as powers of attorney or guardians. The point, though, is those executive orders, now the latest one being Executive Order 174, are strictly limitations on visitors entering residential settings. There's nothing in the executive orders that prohibit individuals with disabilities from leaving the residential settings, either to participate in a community program, to visit family members. Obviously, there are challenges related to making certain that individuals social distance properly and use proper protective equipment. But to be clear, the association has communicated to its members from the onset that the limitations in terms of freedom of movement for individuals with disabilities is not related to leaving the residential setting. It's about restrictions on visitors entering the residential settings. And it's our understanding that there is effort being made to not only have we worked on reopening community-based services, skill building programs, employment supports, but there's also efforts being made to reopen, in a sense, the residential settings so that there will be a greater ability for people to visit and do outdoor visits and interact with folks with disabilities who are living either in licensed group homes or in non-licensed residential settings. I do want to emphasize that MALA has an outstanding working relationship with Encompass Michigan and the Community Mental Health Association of Michigan, and we are committed to doing what is in the best interest of maximizing the independence and empowerment of individuals who receive supports through the behavioral health system. Again, it's been a challenging time for everyone, most importantly for the folks who receive supports. And I will, based on that information from an association perspective, turn it over to Jennifer, who can talk about the frontline challenges for residential providers and the staff, and of course, the individuals who are receiving supports. Jennifer?
Hi there. I'm Jennifer Boney, hoping you can all hear me well. I'm the Executive Director and CEO of Progressive Lifestyles. We provide residential services in Oakland County. We have 29 homes that we support. About half of them are adult foster care licensed homes, and then the other half are community living supports 24-hour settings. So throughout this pandemic, our biggest struggle, of course, has been staffing. We, right from the get-go, Progressive Lifestyles back in, well, I think March 13th was our magic date when we had our first case in one of our homes. So we were hit very hard right off the bat with cases numbering in the double digits, and had a few deaths as well, very unfortunately. So the past several weeks, couple of months, things have been going much more smoothly. We have excellent protocol in place that we feel are making a big impact for us on keeping our infection rate extremely low and keeping our staff and the individuals that they serve very safe. So we feel really good about that, but I always try to say that we're taking it one day at a time. We have no one with COVID right now, and a phone call at any time today could change that. So we just never know, and so we try to stay right on top of it. So our experience throughout the pandemic has been really to support the individuals that we're serving and in collaborating with their circle of supports to make the decisions that are right for them about what their community activities should look like. So we appreciate having a seat at the table with the individuals that we serve so that we can figure out if they choose to reenter the community to do whatever variety of activities they're choosing to participate in, that we can help provide appropriate enhanced protections at home to try to minimize the risk of infection to roommates. So what we do is we have a process where we work through with the individual and their family or guardian as appropriate, and we talk about what their personal risks look like. So are they of advanced age? Do they have pre-existing conditions? We kind of talk all of that through. We talk about what their likelihood is and what support they would need to comply with some of the really, we believe, pretty effective mitigating strategies. Mask wearing, hand washing, maintaining social distancing. So we want to have a good understanding of what support they would need in order to comply with those types of important precautions. And then based on all of that information, we try to document a conversation with the individual and their supporters, guardian if appropriate, to understand what it is that they are comfortable doing in the community. So do they want to go back to their original vocational programming? Do they want to continue their community employment or volunteer activity that they were previously doing? And then do they, what kinds of community settings are they comfortable going to with staff support as well? So right now we have individuals, we have a couple of individuals actually who were essential workers and continued to provide the essential supports they were providing to the community throughout the pandemic. They never stopped working, just like our staff never stopped working. So that's something that we've supported with enhanced protections in the home. We have some folks that have returned to their vocational programming. We have some that have returned to volunteer activities. We have some that right now are planning to return, and we're working closely with the individual and their circle to try to plan a safe return. And then we also have some individuals who are participating in virtual vocational activities, and we have some that are not ready to talk about a return yet, and some even that are quite fearful that they could be pressured to return. So depending on the individual and what their situation looks like, we're working closely with them and really just trying to recognize throughout that this is not a decision that belongs to me as the leader of the residential organization. This is a decision that belongs to the individuals that we serve, and our role, as it has always been, is to try to support them in doing the activities that they are wanting to do. So if it's important to them to go back to their vocational program and get those supports, then we support them, and our role is to figure out how to do that safely. And that decision really rests with the folks that we're serving and their supporters. So it has definitely been a challenge. As I mentioned, staffing is incredibly difficult. So we have wanted to partner with the vocational organization so that we can share some of that. We've utilized some contracted staffing from other organizations that were kind enough to support us during the toughest times. I think our biggest barrier to a return to vocational programming for some of our individuals really is around fear. And I think it's the fear that the individuals and their families have, and a lot of that fear, as we learned early on in March and April with the loss of some of the individuals that we serve, that fear is real. And it is justified in many cases. So we want to support people with wherever they are on their journey to returning. But I think we want to honor that and understand that it's fear in the people that we're serving, but it's also fear that we have to work with for our staff. They are fearful of infection for themselves and their families. So if the individuals that we serve, or I shouldn't say if, as the individuals that we serve return to their community activities, the staff's perception of their own safety is incredibly challenging as well. These are staff that have served these individuals sometimes for 5, 10, 20 years. And some of them watched individuals that they cared very deeply about suffer and then go into the hospital and never come out. So we're dealing with real trauma in the staff and trying to help them to be brave. So we talk a lot about we're brave, but we're not reckless. So we put a lot of important precautions in place, but we don't let fear make our decisions for us. We try to focus on the facts, and we try to help our staff understand the precautions that are being put in place. So my perception of the individuals that we serve that have gone back to programming, I feel very good about the precautions that the programs have put in place. I feel good about the strategies that are being used to mitigate the risk when the individuals return to the home. So I feel very positively about it, and I think that that as we continue to move forward, we're going to have more and more individuals who feel comfortable exploring alternative vocational arrangements that allow them to return. Like I think was mentioned by Sherry earlier, we have one home that's exploring the opportunity to consider receiving supports together at a particular program, and they were the individuals and their families were comfortable with that, but they weren't comfortable with going back if they were going to be in a room with other people from other homes. So I think it's all about finding individualized solutions and meeting people really where they are. So that's kind of where we are right now.
Thank you, Jennifer. We did have a few items to address in the chat. Roger Colville asked for clarification on Executive Order 2020-169. And I'm going to ask us to hold off on that because we did ask Brenda to address that as part of her talk today. And he also asked, Tom asked if you and Bob would address or describe the staffing crisis in residential settings. He listed, for example, homes are closing, funding streams are being changed, etc. So he asked if you and Bob would address the funding crisis.
I can lead off and then Jennifer can talk about her experience with progressive lifestyles. It's an excellent question. I don't think it's an overstatement to say, and again, Todd referenced it in his comments, that the three associations and of course providers and advocates and individuals with disabilities are extremely concerned about the staffing issue. It was an enormous challenge before the pandemic. We are absolutely concerned about the viability of various behavioral health services, including residential settings, if something isn't done to address the staffing crisis. We know that the $2 per hour premium pay increase from April 1 to September 30th, while not solving the issue, was certainly a lifeline that we needed. And we are, the three associations, in conjunction with other members of a statewide coalition, we are doing absolutely everything we can to convince the governor and the state legislature to find the dollars, because it will require a GF match starting October 1, to at a minimum continue that premium pay increase, the $2 per hour. We're, once again, the point is we're extremely concerned about what's going to happen with the staffing crisis if we can't at a minimum continue that premium pay increase.
Mm-hmm. And I'll add to that. As Bob said, it's been an incredible challenge even prior to the pandemic, but as soon as the pandemic hit, we had staff who had pre-existing conditions, who were fearful, who had family members that were medically vulnerable, who were no longer able to come into work or no longer comfortable coming into work. So we had a sudden moment where we lost probably 20, 30 staff all at once who said, there's a pandemic, I'm not working, which means that covering the staffing in all of our homes became a really significant challenge. And then with outbreaks happening in the homes, we had to quickly implement quarantine procedures and figure out what our staffing models looked like. For us, luckily, prior to, I would say, the real kickoff of the situation in the middle of March, we had consulted with Dr. Faust at the Oakland County Health Division, who was incredibly helpful with, in February, we came up with basically our pandemic plan. When we saw things start to move, we said, okay, this is coming our way, how are we going to handle it? And so we came up with some staffing patterns for quarantine that Oakland County Health Division agreed would be acceptable, and we came up with some planning. And then as the pandemic hit, we set up a scenario where we asked staff to volunteer. If we had to, would they shelter in place with individuals that had been, where the home had been quarantined. And I'm incredibly moved and happy to say that that list had 20, 30 names on it within 4 or 5 hours. The staff stood up and said, absolutely, if it's needed, I will shelter in place. And so we had, that was our staffing strategy for homes that were in quarantine. If it became necessary, where enough of the staff were ill that they couldn't provide shift work, we ended up having to quarantine, having exposed staff quarantine in place, utilizing full protective equipment for weeks at a time. So we had one home that was in quarantine, I believe, for 32 days, and staff quarantined in place with the individuals. So we got creative. We said, what do we have to do to make this work? And we made it work. But that was how severe the crisis was, that we actually had to have staff stay. Currently, we have no homes in quarantine, so we're very grateful for that. But we always have our plan B and our plan C. And I'm aware of plans from other organizations that involved combining homes where necessary, that involved all kinds of solutions that would need potentially to be put in place because of how incredibly significant the staffing crisis is. And it, like Bob said, at the end of the day, it comes down to funding. Our staff are not paid what you would expect someone to be paid if they were going to make a living wage. And so what we hear a lot is talk about certifications and extra training. And I think that those are very excellent ideas and very important for the legitimization of the profession of caregiving. But I don't think that a staff person should require a certification in order to make a living wage. I think that we should be funded in a way that allows us to pay them fairly for their work, especially during this situation. So that $2 helped incredibly, and the idea that would be going away shortly is going to cause us very real problems when it comes to covering the needs of the people that we serve.
Thank you, Jennifer. I'm not sure if this question is for you or if it's for Sherry. Becky asked, with those providing virtual services, for example, skill building, how long are the trainings being provided for when presented? And is there an expectation that a person is to participate for a specific duration?
So I responded in the chat box to that as well, but I will say that here. Our skill building services, the video portion of that is about 45 minutes. And people are pretty good at engaging at that level, but anything that we're doing beyond 1 hour, people start to lose focus. We started that at a longer length of time and have landed at about a 45-minute segment.
Thank you, Sherry. So it would not be 2020 or a virtual meeting without some sort of technical issues. And so our next presenter, Mr. Bob Sheehan from the Community Mental Health Association of Michigan, is presently not, his camera is malfunctioning. And so we are going to ask Bob, I'm going to unmute him, and unfortunately we won't be able to see him. I don't believe we have any additional questions for Bob and Sherry or Bob and Jennifer at this time. So we're going to go to Bob Sheehan from the Community Mental Health Association and Chris Burgess from Health West. Bob, you're up first. If you want to go ahead and unmute your phone, you have the floor.
Thanks, Tedrick. Can you hear me okay?
We can hear you perfectly.
Good. I not seeing me, for those who know me, is a pleasure. So at least you're saved from that. So let me talk a little bit about our association and then talk about what we've done in response to the COVID pandemic, and then talk a bit about our members and their heroic work, and then turn the floor to Chris Burgess. Most of you know we're Culver's group are also members of ours. It also includes the 46 CMHs, who are the public behavioral health care centers in every county, the 10 prepaid health plans, which I think people know are the public Medicaid specialty health plans that focus on behavioral health, that make Medicaid payments. They were formed and are governed by the CMHs. And then about 100 providers, again, many of which who were also members of Bob Stein's Mala group and Todd Culver's Encompass group. So what our association did with the early days, and have been doing it ever since, we quickly formed a COVID web page. There was so much information out there to our members as providers, employers, community members, public bodies, private bodies, relative to financial support, PPE, clinical support, reopening guidance, that we found having a curated web page was pretty important. Secondly, we opened a telehealth resource center. A lot of our members, all of our members, went to telehealth for a large segment of their service array. And of course, a lot of it is still done face to face, and I'll talk about that in a minute. But telehealth was critical, and so that resource center has been very helpful to guide people on best practices. We ordered nearly 100,000 PPE masks and gowns and gloves directly as our association from a national source. And then our members, as Todd and Bob pointed out, have had to scramble to get PPE for its staff. And so they're still scrambling. They have what they need right now, but there's a real concern that as this next spike in COVID, which is, we think, going to be matched by the more traditional flu, the need for PPE is going to go through the ceiling. We also opened up what's called a Heroic Stories site on our website. We found that our members and their staff were doing really incredibly heroic work. And so we wanted to highlight that. And so we've gotten dozens of stories that are posted there that have been picked up by the press. And I say that because our members' staff, as everyone on this phone call has pointed out, especially the direct service staff, direct worker, are paid really terribly, often with thin benefits. And so it's critical that we support them. And as Bob and Todd and others talked about, the workforce shortage that was quite dire prior to the pandemic has really gone through the ceiling. So we found that in supporting our members in a lot of ways, in terms of boosting their morale, was really critical, and was seen as a backstop to what our members were already doing. Our association always, as Bob and Todd are also involved in, we're lobbying for a direct care worker wage increase, what's called a premium pay, as well as a stabilization payment plans, and then work with the Department of Health and Human Services on a waiver flexibility application by the state. And then our members are on a phone call with BHDDA leadership. The CMH and PHP members join them every week for an update on COVID-related efforts. Our members, and Chris Burgess will talk more about it from a Health West perspective, did immense staff training on best practices in contagion control. They, of course, as I said, purchased PPE by the truckload. They've converted to telehealth very rapidly. They had to relocate a number of clients. People who were in congregate settings, especially residential ones, some of them could no longer live side by side because of either contagion or because of threat of contagion. They put in place pretty intense sanitation efforts and continue that today. Sanitation that goes beyond what most of us live with day to day. They also provide an awful lot of client and family and staff support. As everyone on the phone said, this pandemic is hitting people hard. A lot of the families, in fact, of clients lost employment and work connection. For some of these clients, their whole family lost a work connection, living off of unemployment only. And so a lot of support has been wrapped around them. And our CMHs are also deeply involved in community responses. A lot of our CMHs and our members are doing COVID testing, COVID transport to testing, and they've had to ramp up their COVID related transportation system, where if you could use a van before, you can no longer use a van. So the transportation costs and the residential costs of our members went through the ceiling, as you're now moving people who used to be in more congregate settings and congregate transportation into more standalone individual transportation and residential settings. So with that, Tedra, I will turn the floor over to Chris Burgess from Health West.
Thank you, Bob. Chris?
Thank you, and good morning, everyone. My name is Chris Burgess, and I'm the Clinical Services Manager for Supported Employment at Health West, or the CMH in Muskegon County. I had focused my comments on the employment supports and community-based programming, but Bob, you did mention partnerships, and I just want to mention that, as Bob had mentioned, Health West is very much in partnership with our local health department. Our director has been deputized by the director of the health department, and we have done a lot of COVID testing, and a lot of our internal community relations team has been loaned out basically part-time to the health department to help the community learn more about COVID. We have a mask up campaign. We have a campaign to recognize local businesses that are following safe practices. So we have been very engaged in our community related to COVID and maintaining safety related to that. Related to the topic of services, I just want to say that Health West and our provider network's journey through COVID actually started well before we ever heard of COVID. I'm going to give a little bit of background, and it may sound like, how is this connected? But I hope you'll see how it is connected. Several years ago, we recognized locally that we needed to take a look at how services for individuals with intellectual and developmental disabilities were provided in our community. And we recognized that while the MI service world had been greatly impacted by evidence-based practices, it wasn't quite the same for folks with intellectual and developmental disabilities. So Health West invited our largest providers and our advocacy agencies in the community to come together to start a discussion of what services looked like currently and what we needed them to look like in the future. We struggled a bit getting started and organized. However, we established what we have now identified as the IDD Consortium, and we have established various working subgroups within that larger consortium, and one of those was the Employment Subcommittee. I'm sorry, I just lost my space. Early on, we recognized the need to support more individuals in reaching their employment goals. Too many individuals were being referred to skill building service, and once they started receiving that service, many never progressed to more community integrated employment opportunities. So at the same time we were doing that, Morrow, now Encompass, was offering grants related to changing employment outcomes. And as a consortium, we applied for and received a provider system transformation grant, and then also a year or so later applied for and received a grant to support rate restructuring in the skill building and employment arena, having clearly identified that if we wanted to change the way services are provided, we had to be able to support that financially. The employment subcommittee meetings include reps from Health West, the organizations who provided skill building and vocational services, Michigan Rehabilitation Services, our local intermediate school district, our local advocacy groups, individuals that we serve. We were able to build very strong, transparent relationships with each other, and these types of relationships were so necessary during the pandemic. So all of that being said, we were tooling along with our regular meetings and COVID strikes, and suddenly we're staying at home due to the governor's various orders. And as many people have said, I think the behavioral health community, those first few weeks was just trying to figure out how we were going to provide services and survive as organizations. As the pandemic continued, several things happened in our community. One being that Health West reorganized structurally. Prior ways of doing business weren't as effective as during a pandemic as they were previously. So one specific change that we made was creating a team of staff whose focus was specifically on provider issues. So when communication came to Health West that needed to get out to providers, it was accomplished through this group of people. And then vice versa, if providers had issues or questions, they were asked to communicate with this group of people within Health West. And there were several other teams like that formed throughout Health West. And then members of those teams at Health West got together as a COVID response team so that we were all addressing issues and able to respond to people with one voice. So as a member of the provider team, after about a month of trying to figure things out, in response to so many provider questions, we established a weekly meeting with the skill building and vocational providers to start to talk about how to provide services through telehealth, how to bill that service, ways to provide remote supports to people who are working. We started to talk about reentry plans to skill building and vocational services. We included a supports coordinator supervisor on that team so we could address any treatment planning or service authorization issues more quickly. People participating in that subset of the larger, people participating were a subset of the larger employment subcommittee that I mentioned earlier. All of the relationships established through the pre-COVID work that we had done served us so well through the pandemic. We already trusted each other and didn't have to do all the relationship and trust building work, in addition to the work of talking about how our individual organizations were impacted by COVID and our reentry plans. During each meeting, each organization would give an update on what was happening at that organization. This included Health West, so our providers knew what our reentry plans were, what we were dealing with on a regular basis, and each provider then was able to give an update on what was going on in their agency. And we also included MRS in our group. And I think it's very important to note that the conversation with MRS, the work with MRS continued through the pandemic, and our efforts to continue to move people through MRS continued. It was slower for sure than pre-COVID, but the work continued through the pandemic. In addition to the meetings, we were all sharing as many resources that we were receiving regarding providing employment services during COVID. Most of us were affiliated with other larger employment networks, and so any information or training opportunities we became aware of were shared so that many of us who wanted to participate in those larger learning opportunities were informed about those. So some examples of that were training resources from APSE, Encompass, the National Council, ODEP, just anything we ran across, we shared. When services started, we were fortunate to not have any individuals show symptoms of COVID-19, and then we have backed down our meetings first initially to bi-weekly, and now we're back just this month to our regular pre-COVID employment schedule of meetings on a monthly basis. Because several of the local providers provided services in other counties in our PIHP, we also had communication with other CMHs in the region. Sometimes orders from the governor or guidance from MDHHS were interpreted in different ways by different organizations. So it was really helpful to see clarification and understanding throughout the region. So again, we could respond to provider needs more cohesively. Each organization that we were working with established its own reentry plan. Health West did not manage that or give people permission to return to various services. Through the initial phases of the stay-at-home order, each provider agency was having communication with individuals who were enrolled in their services, and the individual, their guardians, natural support all determined if and or when that person would return to service. Each provider has its own safety protocols that need to be followed. All returned to providing in-person services around the 1st of July. Because we had a community-wide mandatory COVID testing of all AFC home residents and staff early in July, some providers decided to reenter services with individuals living in settings other than AFC homes to get started. Other providers started services with people who consistently could wear face masks throughout the program day. Again, each had their own plan that addressed how many individuals were able to return, when, their transportation needs, and how those were going to get met, et cetera. Currently, our provider return rate ranges between 40 and 75%. So things have gone quite smoothly, given that it's a pandemic, and for the most part, we're all continuing to work virtually. Everything has not been smooth sailing, yet we're continuing to work together to the benefit of those receiving services. The majority of individuals involved in community integrated employment have returned to their jobs. If they haven't, it's primarily because their workplace hasn't reopened or the employer continues to operate with a reduced crew. The extension of the stay-at-home order was, throughout those first months, was frustrating to providers who wanted to get back to in-person services earlier than that July timeframe. Health West is in a region that we identify and believe is underfunded and certainly is overspent, and thus mandates for the premium pay for direct support staff have been difficult to send to the providers when we don't have that money in hand up front. Yet through all of this, I'm very proud of the work that we've done locally, both at Health West and then also as the larger provider network. And that's all I have.
Thank you, Chris. So we have, before we move on to Brenda, Sue Hendricks. Sue, I'm unmuting you, or you can unmute now. She had has had her virtual hand raised since Bob was talking, so we're going to go to Sue first. And at this time, if you have questions for Bob or Chris about how CMHs have responded, now's the time to ask. And then Sherry, we have another question for you in the Q&A that we'll get to in a bit. Sue, you can go ahead and unmute and ask your question.
I'm going to say that's a technical difficulty and did not realize that my virtual hand was raised. I apologize.
No worries, it happens. Thank you. Are there any questions for Bob or Chris? Okay, so Sherry, hi Sherry. Felicia wants to know if your agency is being paid for the virtual skill building.
Yes, we're receiving reimbursement for those services.
Thank you. Brenda, let me find Brenda. I don't see any other questions or comments for Bob and Sherry right now, so we're going to go ahead to Brenda. Oh, no. So Tony is asking, if staff is exposed to COVID by a person who was tested positive, CDC indicated that testing is not necessary for the staff person. We disagree. What are your thoughts? And I think this is for anyone on the panel, Tony, or did you have a a specific person in mind?
Tedra, this is Bob Sheehan. We can go ahead and answer that question.
Okay.
I mean, Tony's implying the right answer. If a staff member's been exposed to anyone, a client or a family member or anyone, they should get tested. I think it makes a lot of sense. He's right. CDC recently gave notice that testing wasn't all that important if you were only exposed. And I think most public health experts have come out and said that isn't true. And I expect CDC to retract that in the next several days.
Thank you, Bob. Brenda?
Yes, ma'am.
Are you ready? We are going to you now. So Brenda Stoneburner works for Behavioral Health and Developmental Disability Administration, and we asked her to join us today on the webinar. Brenda is also experiencing technical issues this morning, so we won't see her on video, but she still has some really valuable information to share with us. And so Brenda, I'm going to turn it over to you.
Great, thank you. And my apologies for the technical difficulties. I was actually facilitating a meeting earlier this morning and my entire internet went out. So some quick text messages to others that were on the call to take over. So hopefully that doesn't work, or that doesn't happen during this. So just very quickly, I'm the manager of the Community-Based Practices and Innovations section within Behavioral Health and Developmental Disabilities, the Division of Quality Management and Planning. So I was asked to address from the standpoint of BHDDA, part of what we have been doing during the course of the pandemic and any clarification or guidance that we've been giving. So I wanted to start with, throughout the pandemic and as regions across the state were reopening in various stages, the direction has been given both acknowledging the prepaid inpatient health plans, PIHPs, and the CMHs. They were all at various stages of reopening their sites based on their settings and services, as well as what region of the state they were in. Throughout this whole process, it's been an expectation that PIHPs and CMHs will work with their provider network to develop their reopening strategies and what that entails. The strategies were to be based on the unique features of the physical space, the environmental assessment of each location, the ability to physically distance, the availability of personal protection equipment, and how best to support the individuals that they serve in accordance with their individual plan of service through a person-centered planning process. This truly has been and is a local decision, given all those different variables. It's been referenced a couple times in the call, a couple of documents that have been released both by BHDDA as well as the Department of Health and Human Services. Two in particular from BHDDA, both of these were issued on July 8th. The first one is the Resident Freedom of Movement and Visits with Lifting of the Stay Home, Stay Safe Executive Order. And this is document 20-10. The key takeaway from this document is that individuals are allowed to move about the community as anyone else would, including those who are in adult foster care settings or specialized residential settings. It speaks specifically that facilities must provide the services from a person-centered planning approach, and that includes the ability for the individuals to engage in activities in their community as currently permitted within the context of COVID-19. The individuals living in a care facility should not be prohibited from exiting their home where they would otherwise have freedom of movement to go into the community, and that they should continue to have access to home and community-based services based on their plan of service. So that's the one document. Another document is infection control issues during patient close contact face-to-face assessment in behavioral health clinic settings in COVID-19. This was updated guidance, communication number 20-12, also on July 8th was released. And the key takeaway from this document is it provides guidance on infection control and the use of PPE and masks for those who work directly with persons served in behavioral health or SUD community-based settings. Another document that was released by the department, which is a phased approach to resuming standard operations for case management and other home and community-based services. This was issued on July 13th. Part of this, or this document, really provides guidance that follows the Michigan Safe Start Plan issued by Governor Whitmer on May 7th. And it applies to safely restarting home and community-based services for adults in Michigan. The intended audience for this is employees who perform case management and coordination duties, including case managers, supports coordinators, care coordinators, as well as those who provide hands-on assistance to individuals, including personal care assistants, direct care workers, aides, CNAs, and caregivers. This guidance is in effect until the entire state has concluded 60 days of phase 6 of the Safe Start Plan. So that would be 60 days, the entire state post-pandemic. So in addition to some of these documents, the department was also able to receive approval from CMS for expanded use of telepractice, and the move of providers toward more home and community-based services that's been happening over the past few months and years. Under the HCBS rules, hopefully the movement that has been happening towards that has helped to set the stage for smoother transition of some of these services to the community as opposed to specific settings. It's important to keep in mind, and it was nice to hear others speaking to this, that first and foremost, the safety and health of individuals is paramount. That's important to keep in mind, especially since many of the services that are provided through the network are provided to individuals who may be most at risk for adverse outcomes if they contract COVID-19. It also speaks to the importance of being essential. Every person is evaluated individually, and flexibility and the use of judgment for each individual and scenario is important. At the specific local level and individual issues as they may come up, two things that have continued throughout this is that the CMH's PIHPs, there is a customer service link. And so individuals or their families, if they have a question about what is or isn't allowed, and they don't think that they're getting an answer or aren't comfortable with the answer or just wanted to get clarification on that, they're always able to contact the customer service people, or depending on the nature of the issue, the recipient rights process is also still available and could be initiated. So that's a very quick overview of what the department has been doing and providing. Both the documents, actually all three of the documents that I referenced are on the michigan.gov/MDHHS website. I can put that in the chat after we're done, if that would be helpful. Once on that site, the overarching MDHHS site, if you click on the BHDDA tab for the guidance documents, that's towards the bottom of the page, the Behavioral Health Developmental Disabilities Administration. Click on that tab, I think it's to the right, and then scroll to the bottom of that page, and it will take you to not only these two guidance documents, but others that have been released. And as far as the phased approach, that is on the coronavirus website that you get to through the MDHHS site. And when you're on that website, click on the Healthcare Professionals tab, and it's one of the documents that's available there. So I think that's all I had.
Brenda, we ask that you address the executive orders in terms, in reference to the freedom of movement. So there was Executive Order 169 and 170, as well as 174 that was formerly Executive Order 7, and how those should be implemented with respect to the freedom of movement document that the department issued.
Okay. Pedro, I apologize for that. My understanding was you wanted specifically the resident freedom of movement document addressed, not the specific executive orders. So if there are questions related to the specific executive orders that aren't addressed in the freedom of movement, if you could put those in the chat and then send those to me, and I can follow up and get back with you on that.
Okay, thank you. So there were a couple of questions. I'm not sure specifically if these were questions for Brenda. And I'm thinking that these are questions either for the associations or for the local providers. Lisa says that communication has been extremely difficult. How has everyone been able to communicate with families and participants who often do not have internet access?
This is Sherry. I think most of even for those families who do have internet access, most of our communication with them has been just by telephone. Telephone, some follow-up stuff in the mail, but other than the specific virtual services that we're providing, we're not really using the internet to interact with those folks any more than we used to be.
This is Chris from Health West. And I would say we have the same issue. It's very difficult to connect with people sometimes. The most frequent way we do that is through phone. We do have a lot of virtual groups that are available through Health West, but not all of our people have access to the electronic equipment, the internet, to make that possible. So that is a challenge.
Thank you, Sherry. And Chris. So what are some of the ways that you are outreaching to families? How are people getting information? Are you using I'm gonna laugh, but the United States Postal Service? Are we mailing stuff to folks, or how are people being notified when there's so many changes happening so quickly?
So for us, yes, we're using all communications means possible. We do send things through the mail. We are asked to contact each of our individuals that we serve on a weekly basis to make sure that they are safe and healthy and getting the information that we need. We are also regularly updating our social media, our Facebook pages, and other newsletters and things that we put out. We're making sure that those are regularly updated, and our webpage, so that people have access to everything that they need.
And I would echo everything that Chris just said. That's what we're doing as well.
Great, thank you, ladies. Now we do have a few minutes if anyone has questions for any of our panelists. And one of the things that we know and we acknowledged as we started this, as we're planning the webinar for today, is that this is really the beginning of a conversation that will hopefully lead to working together to address this and really help people get back into the community with MALA, with the Board Association, and with Encompass. So if there are any questions, we have about 3 or 4 minutes, and there was a question that I missed in the chat. So I'm going to ask this one question. Is it against the right of an individual if the provider wants to keep an individual home from workshop now to prevent COVID exposure and keep them safe? So is it against the right of the individual? And there was another question that we missed that came through the chat, and I'm going to find that. And I'm going to give that question to Mr. Stein, I think.
Certainly, Tedra. The answer is that it's not the provider's decision whether or not the individual leaves the residential setting to participate in community-based services. Obviously, there are always precautions that need to be taken for health and safety reasons, and the support circle of the individual should participate to the extent possible. But on the specific question of whether or not a residential provider can prevent an individual from leaving a residential setting to engage in community activities, the answer is the provider does not have that right.
Thank you. Pam asked, are you able to arrange social distancing with individuals you serve and make sure they keep their masks on? And I think that this was a question that came in the chat when Jennifer was talking. And they're wanting to know if you can make sure that people keep their mask on when they are in the community.
Well, I will say that it is definitely a challenge. We have some folks that are very capable of keeping a mask on, and other folks that need encouragement. And with that encouragement, they can safely participate in those activities. I would say, because we have a large amount of individuals who are not going to be able to be compliant with the governor's order about mask wearing and social distancing in public, we've tried to work with the individuals to arrange for outings that are lower risk to begin with. So we've focused on community access in areas that are not crowded, like going to parks, having a picnic, having socially distanced visits with family or friends out in the community. Outside of areas that are likely to require a mask based on the governor's order to wear a mask or socially distance in the community. So it's really very individualized. But we have some folks who it's no problem whatsoever. I mean, they're uncomfortable because we know that wearing a mask is less comfortable than not wearing a mask. We all experience that every day. And so I think that the same struggle applies for the folks that we're serving. And it really all depends on the individual's preference and what they've chosen to participate out in the community. So the short answer is it's a huge struggle. It's really, really difficult. And we're using all of our skills and all of our best strategies to try to make it happen as much as we can.
Thank you, Jennifer. Bob Stein, can you prevent an individual from attending a vocational program or supported employment if they refuse or can't wear a mask?
Question is, With regard to an individual returning to a skill building program or other community-based service, I think it's a collective discussion that has to occur involving the individual, the supports coordination process, to identify what risks are involved with the person returning to the program. And I think that it also, even in the department guidance documents, resident freedom of movement and other documents, it does talk about, yes, individuals absolutely have the right to access community-based services, but we do need to be certain that the proper safety protocols are in place. So, and I think Jennifer makes an excellent point. It's individual specific. We have to look at all the circumstances involving a particular individual and what they want as well as what's in their best interest.
Thank you. Well, we have reached 12:31. I'm going to give one more call for questions for any of our panelists. I would like to thank our panelists so much for joining us today and sharing this really good information. We did have over 100 people on Zoom and around 20 people on Facebook. So a lot of people got your information, and we are hopeful that they will share that. The recording for the webinar will be up next by probably midweek next week with the holiday. And we will attach a document to that references some of the documents that has links to some of the documents that Brenda talked about in her during her presentation. We hope you will join us next Thursday at 11, where we will have the staff from the Office of Special Education at the Michigan Department of Education talking with us about their latest guidance for school reopening. And that guidance was just issued a couple weeks ago. So they are coming to the webinar to go over that guidance with parents, families, and any other interested others. So we hope that you will join us again next Thursday. Have a great holiday weekend, everyone, and goodbye.
Thank you.
Thank you, Deidre.
Bye-bye.